Love this podcast? Support it and sponsor today. Simply head to ozcastnetwork.com for details.
Welcome to Hong Kong Confidential. I'm Jules Hannaford and I'm your host. I'm an Australian woman and I've been living in Hong Kong for many years. I'm a mother, a teacher, an author, and I want to share my wisdom and the wisdom of others with you. Thanks for joining me and I hope you enjoy the show.
You meet someone online and there's this instant connection. It's amazing how much the two of you just seem to click. They live somewhere far away and there's some plausible reason they can't travel to meet you. They tell you they're in love with you and you feel optimistic for the first time in a long time. They have a successful career, yet somehow they need money from you to solve a short-term problem, always with the promise of paying you back. Time goes on and they need more money more urgently. You've started to see the cracks and begin to wonder whether they've been lying this whole time. All of a sudden it hits you. You've been scammed. Fool Me Twice is the story of my mother, Jules Hannaford, a woman who was drawn into the dangerous world of sweetheart scams. After a trip overseas to meet a stranger, a dangerous altercation in a Manchester hotel room, and thousands of pounds lost for good, she's here to tell her story. Fool Me Twice, a true crime podcast, is available on Apple Podcasts, Ozcast Network, and anywhere you listen to your podcasts.
Today I'm here with Stephanie Eber. Hi Stephanie, thank you so much for joining me today.
Hi Jules, thanks for having me.
Stephanie, how did you end up in Hong Kong and where are you from?
I'm from Sydney, Australia, and I've been in Hong Kong for just over 6 years now. To make the decision to move to Hong Kong, my husband had to do an overseas secondment and we thought Hong Kong's a great place to go to. We've been here for holidays. We thought we'll try it and see if we like it, and we moved here for 2 years and then of course we ended up staying much longer than we expected, and 6 years later we still have no immediate plans to go back. It's just such a great place to live, I think.
It's a great place. I came for 2 years as a teacher and I'm still here 20 years later. I completely understand. Stephanie, why did you decide to become a speech therapist?
I wanted to work in the health field and I researched all the different allied health professions. I didn't want anything too medical because I get a little bit sick when I'm exposed to too much blood and gore, so I knew anything that caused pain or involved blood was out of the question. I started researching and I came across speech pathology, speech therapy as they call it here in Hong Kong, and it just seemed like a really fun profession to be a part of. I did some work experience and the speech therapist basically played with children most of the day and they incorporated their language and their speech goals into play. So I thought that's something that I think I might enjoy. So I gave it a go and yeah, I love it. It's a great profession to be part of.
Sounds so interesting. I think it was something that I actually did consider when I was thinking about my career back in the dark ages. You used to work at Sarah Rowe Centre. What did you do there?
Yeah, so I was the senior speech therapist, ESF's Jockey Club Sarah Rowe School for the last 6 years. So I got the job before I even moved to Hong Kong and came over and just left a couple of weeks ago, actually. So being the senior speech therapist, I was in charge of the speech and communication and swallowing needs of the kids attending the school. There were 2 speech therapists. I work with half of the students there and the other speech therapists work with the other half. We had a huge range of children at Sarah Rowe. There were some children that weren't able to talk, weren't able to walk, and they had much higher needs. And then we had children that were able to have conversations, have jokes, much more higher functioning, but they didn't cope very well in a mainstream school. Sometimes when there's too many kids in a classroom, it gets a little bit overwhelming and these kids get lost. Sarah Rowe was a nice place for these children who definitely had intellectual delays or impairments. It helped them to really embrace school, learn a lot in a much more small, supportive environment, and to make friends. And these kids were often so happy when they came to our schools. I would assess these students and then work with them in the classroom. So working on mostly language type goals. So giving kids who weren't able to talk a way to communicate. And the kids that were able to talk, I'd expand what they were able to say or to do. And I'd also work on vocational skills. So working with the team of teachers and occupational therapists and our physio as well to support these kids to be able to learn essential life skills so that they could get a job later on if that's what they wanted, and be able to be as independent as possible in the community.
That actually sounds like a really rewarding job, which is actually more than just speech therapy in a way. You're doing a lot more for preparing them for the wider world.
Definitely. I mean, that's the key goal really with children, with any children really, and especially children with disabilities who might need that little bit of extra help to embrace the community and be active participants. So we really work to look at what they can do, what they can't do, and then trying to overcome whatever barriers. And we work in a real team-based approach. The therapy team were very close and worked very closely together. And we worked with the teachers and helped to embed our therapy goals within the school curriculum, and work with the parents to try and make sure that the goals that we're working on at school really align with what the parents wanted to work on at home.
Oh, that's absolutely brilliant. I'm so impressed. And then you've decided to go into private practice. So what was your motivation for leaving that world of kind of education to go into your own private practice or to join a private practice?
So I loved working at Sarah Rowe. It was a great place to work. It's a great vibe there. Everyone was so lovely. But I think when you work at somewhere for a long time, you become a little bit complacent. And I just felt like I needed a new challenge. I needed a different routine. I had a couple of kids while I was working at Sarah Rowe. So I have 2 young children now. And I wanted a little bit more flexibility in my life. Able to take my son to kindergarten every day, being able to volunteer at the school on occasion. And I also wanted to help the kids that can't get into Sarah Rowe. So there's such limited spaces and the number of kids on the waiting list is huge. And there's not a lot of options, affordable options, I should say, for children with disabilities in Hong Kong. There are a lot of kids that really needed support and weren't getting it. So I thought if I can work in private practice, I can use my skills that I've learned both before I moved to Hong Kong as well as at Sarah Rowe to help these other children best support their needs and be able to communicate effectively. So that's the main reason. Just change of lifestyle, new challenge, learn more, stretch myself, as well as have more flexibility in my life.
That makes complete sense, especially with young children. And I knew there was probably a waiting list at Sarah Rowe, but I didn't realise it was a long waiting list. And that's great that you're able to help those children that can't get a spot yet at Sarah Rowe. So that's awesome. What kind of work do you do as a speech therapist in your private practice? Are you working only with children again, or have you expanded your repertoire?
My skill set is the speech therapists are trained in so many different areas. It's a huge field. It's bigger than what a lot of people actually realise. My specialty has always been disability. I've learned a lot about that. I've worked intensively with children with disabilities and autism, and I do love working in that field. But working in private practice, I have now taken on a more expanded caseload, so working with a more bigger variety of clients. So the practice that I'm working at is actually, it's more of a psychology counselling based practice, the Blurton Family Development Centre. So they have a great team of psychologists and counsellors that work with children, and they're also heavily affiliated with the Harbour School, which also has a great population, a number of students who do have special needs as well. So working in the private practice, I will be seeing children both at the centre, which is in Central, as well as at the Harbour School. It's kids that go there I can actually see during school hours. But also anybody who needs therapies, anybody in the community who has particular needs that they would like addressed, I can help with them. And I've recently got into a new area, which I think is quite exciting and interesting, that my son's dentist actually encouraged me to go into just in one of his dental appointments, which is called orofacial myofunctional therapy, which is really interesting and something that I hadn't really learnt much about because not traditionally taught in our speech therapy courses, but I've become trained up in that, and I'm excited to start seeing clients in this area as well.
What is that? What does that mean? Orofacial myofunctional therapy.
It's quite a tongue twister, I know.
Yeah, it is.
Yeah, It's essentially retraining the muscles in somebody's mouth and lips and face so they can chew, breathe, and swallow appropriately. Really, when you think about when you're at rest right now, your lips should be closed, your teeth should be slightly apart, and your tongue should be resting on your hard palate, which is that hard structure at the top of your mouth. That's how everybody's resting face position should be, whether or not you're a child or you're an adult. But there's a number of reasons why this might not be happening, like if you have a history of thumb sucking, or you have some breathing obstructions or allergies, or you might have a structural condition like a lip or tongue tie that could be stopping this position. And if you don't have this correct resting tongue position, there's a lot of long-term repercussions in that can affect speech as well as breathing and eating, drinking as well. Essentially, that's what it is, retraining the muscles in somebody's face and mouth.
Oh, cool. So that sounds like a really interesting area. Interesting that it came from the dentist, because do they see a lot of these problems in their work?
Yeah, exactly. They do. And it's so great when you can have a team of health professionals work together. It just makes the client have their needs met so much faster and so much more efficiently because you have people working in different areas. So, for instance, the dentist and the orthodontist might be working on the hard tissue, the teeth and the bones of the face, whereas speech therapists and orofacial myofunctional therapists, they work on the softer tissue like the tongue and the lips and the cheek muscles. So working collaborative is when you do have the most impact.
That makes complete sense. And would it be fair to say that this condition, you're born with it, or that can it come from like having an accident as well?
A lot of it can happen from having an accident. A lot of issues can happen later in life by people who do have things like head injuries or strokes, and they might require speech therapy for different reasons. Like they might have a change in their ability to swallow or a change in their ability to communicate with people. In terms of their facial muscles, yes, it could be from having something traumatic happen to them. But sometimes it can happen in adults for people that had some undiagnosed issues earlier in their life, like a tongue tie, which is often not diagnosed by a doctor or a dentist or a speech therapist, because when you have to look underneath the tongue, a lot of professionals don't do that. It could just be something structural that hasn't been picked up in somebody's
So being
life.
tongue-tied, it's not actually like a metaphor for the way that you can't get your words out, but it's an actual physical condition, is it?
Yeah, it's an actual physical condition.
Oh, I didn't know that.
Great, I've taught you something.
Yeah. So
Yes.
you taught me two things. I didn't know what orofacial myofunctional therapy was either, so I'm learning a lot already.
Yeah. Orofacial myofunctional therapy is traditionally done by either a speech therapist or a dentist or even a dental hygienist that's done particular training in that area. Tongue ties are when the little bit of skin, the frenulum underneath the tongue, is tight or quite short. And it really restricts somebody's movement of their tongue, which means that they can't effectively clear the food that they chewed when they're eating and drinking. So they might have more food that gets stuck in their sides of their mouth, which can cause dental cavities over time as well. And it can also really physically change the shape of somebody's face. So people who do have a tongue tie, their face can't grow as it's meant to grow. So they ended up having a short and restricted face.
Oh, how interesting. Wow.
Yeah, and they can also be in a forward head position. And they can even have digestive issues because they're taking in more air when they're eating. And they're also more likely to be a snorer and to have sleep apnea, so breathing issues. There's a lot of repercussions from having a tongue tie that people actually don't realize. And when you do work on it, it can really change somebody's life because they can sleep better, they can breathe better, they can talk better, and their confidence grows up. Their confidence improves so much as well. And their face actually changes a lot. It's amazing to see even adults when they have their tongue tie fixed, the shape of their face actually really changes.
Oh, that's amazing. How interesting. You've talked about the orofacial myofunctional therapy. You've talked about working with children with disabilities and the tongue tie. What other issues do you work with? Like, I'm imagining, for example, a stutter might be something that you would work with.
Yeah, that's definitely one area of speech therapy that most speech therapists would be able to address as part of our training. So in terms of speech therapy is actually a huge area and there's so many different domains. I break it down a little bit more. In terms of children, if I look at the pediatric population, in terms of the myofunctional therapy aspect of children, I might work with children that are still sucking their thumb or still sucking a dummy or pacifier when they shouldn't be doing that, so past 3. So working on them getting rid of that bad habit, as well as dealing with the repercussions of those habits. So for instance, kids that have been sucking their thumb or sucking a pacifier for too long, it can change the resting tongue positions. Their tongue might push forward a little bit more against their teeth, both when they eat and both when they talk. So it can change their speech. It can change the strength of their tongue, the strength of their lips. And it also can change their dentitions. They might have an open bite, so their teeth don't meet properly. With orofacial therapy, I can help to address these repercussions, which can then help to prevent the extent of orthodontic treatment that they would need when they are in adolescence. So if you can work on someone's face early, then you can do some preventative measures to reduce how much orthodontic treatment is actually needed.
Gosh, that is a lot of issues that can come from having a dummy or a pacifier. It's not a good idea, clearly, to give them to your child.
It's definitely not a good idea to give a dummy unless there is a reason, like the child is in the special care nursery when they're born really premature or they're very unwell, and they might be given a pacifier or a dummy to help develop the sucking motions. But normally developing children, ideally, if you can try and not use a dummy, then that's better, as well as thumb sucking. I know even my son, he was sucking from in utero. So it's really hard to address that behavior. And also, they need it. Babies often need to suck. Some children they need that oral sensation. It's very calming, very nurturing for them. So I think it's okay that they do it when they need to, but then if it does go on for too long, I would try and get rid of it. So there are some behaviors. But also speech therapists, we work on definitely stuttering with children, as well as children who have language delays and disorders. Children who are not talking as well as they should be or not understanding as much as what their peers would. We work on literacy skills, so children that are having some problems with recognizing letter sounds and developing early reading skills. And there is a big link between children who do have speech articulation errors and reading. Children who have speech errors are more likely to develop literacy errors, so they kind of work hand in hand as well.
Oh, that's interesting.
Yes, and eating and drinking as well. So a lot of people don't realize that speech therapists do work with children who do have eating and drinking problems. Kids that may be dribbling or drooling a lot, or they might refuse to chew things, chew harder textures, or potentially they might be fussy eaters and avoid different sensations. We might work with a team, potentially an occupational therapist, potentially a psychologist, to overcome these issues. That's what we do with children. With adults, it's a little bit different. We can work with adults who have had a traumatic injury, like a brain injury from a stroke or from a car accident or from an assault. And also adults who might have a degenerative conditions. They might have something like multiple sclerosis or Parkinson's disease, which can change their eating and drinking ability over time. Or perhaps they're going through surgery or there might be palliative care. There's a lot of things we can do around their eating and drinking as well as their communication. So really, we work with people across the whole lifespan, basically.
That's so cool. Stephanie, how do you help children who are unable to speak? How do you help them communicate?
A lot of kids at CRO were unable to speak, and I've even been seeing a few clients in our private practice that are unable to speak. They might make some sounds, some vocalizations, but they're unable to make actual words. So there's a couple of different ways we can do it. We can either use a paper-based system, so like a communication book where children can learn to point to pictures, or somebody might name the pictures and they might use their eyes or their mouth or make a sound to indicate that that's the picture they're talking about. So we can use a paper-based system. We might also use sign language, so teach children or adults how to use particular gestures so they can communicate without having to speak. Another way we can do it is using technology, and this is a really exciting area that is constantly evolving. So using iPads and different apps that help people to communicate. They have voice output, and by that I mean you either point to a picture on an iPad app, particular app, or you can use a button. It's like a button that talks to the iPad, and you can use that with your hand or your head or your leg or any part of your body to essentially move a cursor on the screen so that you can name different words and even make sentences. So technology is really exciting, and there's a lot of different things that we can do nowadays with children who are unable to speak. Pictures, low tech, sign language, as well as using different computer-based systems as well.
Has technology evolved a lot since you started as a speech therapist?
It really has. It has a lot. When I first started about 14 years ago in Sydney, I worked for a government organisation that provided government-funded services to children with disabilities. And when you needed to have a communication device that was that spoke for someone, it was a high-tech device, we call it, that like a computer-based system, you had to spend thousands and thousands of dollars buying a standalone device. It was very, very expensive. So it wasn't affordable for most clients because iPads didn't really exist back then. So there was nothing that was affordable for these types of students. So you would really have to rely on more paper-based models because they were cheaper and they were easy to make. But they were also quite difficult because it took a long time to make the devices, to print, to laminate, then to make changes as you went on. Nowadays, because iPads are available and the apps are less than what these standalone devices would be, it's just so much more achievable for families to be able to buy these different systems and use them. And there's more training opportunities as well. So a lot of the app developers have a lot of online content where you can learn more, a lot of Facebook pages for different communication devices so parents can connect and share information and learn from each other. And you can also ask questions from the developers. It's definitely changed a lot over the last few years and for the better as well.
I can imagine also that with social media, it really does connect parents with children with disabilities and challenges. So it probably makes them feel not so alone and they're able to get more ideas and get more support from each other, which has got to be a good thing, doesn't it? Brings the community together more.
Definitely. And it's a lonely world, I think, if you have a child that has a diagnosis when they're born and you don't know who to talk to. And yeah, it's very isolating. And if you can connect with other people, then you can learn about which therapist you can see and which therapist will do this and will do that. And then there's support groups they can meet together and share ideas. Yeah, it's very valuable.
Do you help children overcome some bad habits? Like what kind of things might they be?
Bad habits, we'll probably be talking about things like thumb sucking and sucking a pacifier or dummy. And even sucking using a baby bottle for too long. They're definitely bad habits that, as I mentioned before, can have some repercussions with both speech as well as tongue position.
I was shocked at how many repercussions. It's like, oh my gosh, it's crazy.
It is. I didn't realize until I had a son who was a constant thumb sucker, and I was getting told different things by different pediatric dentists. And they were saying, one told me that it'll be fine as long as he outgrows it before his adult teeth came in. But that really wasn't the case because already for a 4-year-old, when he was probably 2, you could see the shape of his hard palate had changed and his teeth weren't being formed in the correct manner that they were meant to be formed. So yeah, there's huge changes that can happen if you do this behavior for too long. I would help with giving some parent trainings, training the parents on how they can help the child to overcome the habits. Could be things like drawing attention to it so the child is aware of what they're doing, and drawing attention to the repercussions as well. So if the child's old enough, explaining to them what it means when they do suck their thumb or when they use a dummy, so how it can change their teeth and what they might need to have later on, like they might need to have some metal on their teeth, which can be quite a big deterrent. And then also encouraging parents to use a lot of positive reinforcements. If they are not sucking their thumb or using a dummy, then giving them rewards on a regular basis to really encourage that and make them feel proud. But I'd also want to look at the reasons why they are still sucking their thumb for a long period of time, because sometimes it can be more structural. Maybe they still need to suck something because they're compensating for something. Like maybe they're compensating for their tongue not being able to reach their hard palate. Body to feel centered and balanced, your center of gravity has to be appropriate. And to get that correct center of balance, it's helpful if your tongue is in the correct resting position. So push against your hard palate. It helps you feel centered and balanced. But if a child's unable to get that position because maybe they have a tongue tie, then they could be sucking their thumbs. They're having that pressure against their hard palate, which could be helping them.
Oh, see, that's interesting. If parents have got a child who is a perpetual thumb sucker and they can't get them to break that habit, they really should come and see you.
Yeah, I'd recommend it. But it also could be maybe the child is anxious about something. Maybe something's happening in the child's life and they just need that sensation of sucking to make them feel calm. Just look at the child and as well as what's going on with them around in their life, so you can help to work out why they're doing it and then help them to address that and then to address the behaviour.
Might you work with a child who's feeling anxious and thumb sucking, or would you refer them on and you would deal more with the structural side of it?
It depends to what extent it is. I mean, I know my limits and I wouldn't want to interfere with someone else's role, and someone can do a better job than me, then I would probably refer on. Yes.
Yeah, cool.
Or I would wait. So if it's somebody that maybe the parents are going through a separation, or maybe there's been a loss in the family, then maybe you just let that behaviour happen for the next 6 months and not work on the thumb sucking because they need it. And then when the time is right, then we might work on it.
Good thinking. That's good. Is it a problem if people breathe with their mouths open? And if yes, why?
It actually is a real problem. And that's one of the red flags that we look for with children as well as adults. If the tongue doesn't rest on their hard palate and the child breathes with their mouth, the development of the child's jaw and teeth doesn't happen like it's meant to happen. They have a restriction in their mouth. So if the tongue is open, the children are more likely to have teeth too crowded, their jaws are likely to be smaller. They potentially could have larger adenoids or tonsils or some allergies that could be preventing them from breathing through their nose. There could be a structural reason for it, which you'd want to get investigated by an allergy doctor or an ENT if it is the tonsil and adenoids query. And also, if somebody's breathing through their mouth, particularly at nighttime, they're more likely to have a poor quality of sleep, maybe some dark circles under their eyes because they're not able to sleep as well as they should be able to. You sleep when your mouth is open, you're more likely to have more of a restless sleep, and you're more likely to snore and have some breathing issues, which can impede on the quality of sleep that you might get. And when you do sleep, breathe through your nose, then you are filtering the air that comes through. And when you're breathing through your mouth, you're not getting that filter. So you're more likely to get sick and get illnesses.
Oh.
Yeah.
Gosh, that's interesting. And do you work with people who snore?
We do work with people who snore. Speech therapists have training in orofacial myofunctional therapy, can work with patients who snore. We can't diagnose or treat sleep disorders, and snoring is a type of sleep disorder. But we can help with the oral and facial muscles and the patterns. So if someone is snoring, it's probably because the back of their tongue, the genioglossus muscles, falling into their airway. So it hits the back of the throat. And I mean, some people think that when a baby snores, it's really cute, but it's not cute because it's actually quite dangerous because their tongue's pushing against their airway, which can be stopping them from breathing, which is quite a concern. Someone snoring, I would refer them to a GP to look at whether a sleep study would be useful. But in saying that, myofunctional therapy and breathing education are also really helpful when treating sleep disorders like snoring, and they can be done in collaboration with doctors and orthodontic treatments as well. Children who may be snoring or adults who may be snoring, it shows that they maybe are not using their mouth and their tongue correctly, and that can lead to later issues. So we'd want to be working on them to train them to use their muscles properly, which can help to prevent the snoring. Yes, we can help people who snore, but we're not the only people. I wouldn't say I could cure snoring or anything like that. Very
Probably
much
lucky you pointed that. You might be getting too many phone calls after this podcast.
Yeah, I'd be referring on.
Yeah. When you're working with adults, what sort of work do you typically do with them?
As I mentioned before, so speech therapists work a lot alongside different population groups, so children as well as adults. We work with people from the start to the end of their life. With adults, we would generally support adults who've been through a traumatic event like a stroke or head injury, and they could have problems communicating well or eating and drinking their regular diet, or adults with degenerative conditions who might have a gradual decline in their communication. But these aren't my main areas, so I'd be referring to a speech therapist who is better at working with adults who do have head injuries and degenerative conditions. I would refer on for that population. But in terms of orofacial myofunctional therapy, the training that I've had, I can help adults who might have some sleeping problems and maybe sleep apnea, and they're not coping well with the approaches that they're using. So I can help to make CPAP machine potentially more comfortable by retraining the muscles and making sure there's nothing structurally going on that can interfere with the CPAP machine being comfortable. I can also help adults who maybe have some pain in their jaw when they're chewing, or just pain in their jaw in general. They might have some jaw instability, so I can help retrain the muscles in their mouth and help their jaw to work more efficiently. And there's a lot of adults who do have undiagnosed tongue ties, which could be stopping them from achieving the correct resting position. And it could be giving them jaw pain, or they could be clenching or grinding their teeth at nighttime, and they could have the digestive issues from inhaling too much air. And also patients who might have had orthodontic treatment a few times, but it's not working because maybe they've worked on the hard tissue, the teeth and the jaw, but the tongue isn't efficient as it should be, or their cheek muscle, their lips aren't being as efficient. So maybe I could help work with those patients in collaboration with the orthodontist to try and make them a bit more comfortable and reduce some of that pain that they might be having.
If somebody came to you and they were grinding their teeth in their sleep, what kind of things would you do to help them?
So if they were grinding their teeth
in their sleep,
I'd be questioning their breathing. Sometimes people who do have breathing issues could be grinding their teeth. I'd be looking inside their mouth and working out if I can see anything going on, and I'd probably be referring to an ear, nose and throat doctor to investigate their breathing and see if there are any obstructions that is stopping them from breathing effectively, because if they get their breathing addressed, that might help reduce some of the teeth grinding.
It can also be related to anxiety as well, can't it, and stress?
It can. That's right. Again, seeing if a psychologist could help as well. And
do you reckon it can be genetic?
Teeth grinding?
Because my mum does it and my daughter does it. So I'm wondering if...
Really?
I'm wondering if it's genetic. I wonder if I do it. I don't think I do.
Maybe the teeth grinding may not be genetic, but the cause of it could be genetic. Could be a breathing issue or something that maybe, or enlarged adenoids or something going on structurally that is causing the teeth grinding.
That's good. Thanks for that hot tip. I'm going to recommend that my daughter sees an ENT. That's a great idea.
It's worthwhile.
Yeah, definitely. And have you worked with anyone with selective mutism? Is that something for a speech therapist, or is that something for a psychologist?
Both. Either of them, if they have had extra training in this, can do the treatment. Yes, I have worked with a few clients who do have selective mutism, a few children, and it's really interesting to work with this population because it's a very different approach. You really have to work with them in a comfortable environment and build their trust. It's a very relationship-based approach. So build their trust and try and get them to open up with you. And then once they do let you in, which they generally do if you have a good relationship, then you can do gradual exposure to them with other people involved in the session and help to open up their opportunities. It's an interesting field, and you can definitely help these children, speech therapists as well as psychologists.
Do you have a client that's made a really big impact on you, or somebody who you've really helped make a significant change in their life, and so it was really rewarding for you as a therapist?
Yeah, lots of times. That's why I like working with the disability population, because you can get children who are completely unable to communicate and nobody has a lot of expectations for them, and they will often just sit in a room not really doing a lot. And then when you can start to introduce a system to them and involve them in their environment and give them a way to participate and communicate their wants and needs, then they are able to be seen differently by the people around them. I've had lots of clients like that, and it's amazing. I've had a lot of children who are autistic, and giving them a way to communicate has just helped them to access the curriculum at school, and they can show what they really can do. That's what I love about speech therapy. You really can help somebody and change somebody's life. It's amazing. I mean, it takes a lot of work, and it has to have the family involved and everybody working together, and you'll obviously have a lot of different therapists, like occupational therapists, that work with you, but it's amazing what you can achieve.
I agree. And that's such an interesting point, because as a school teacher, I can also agree that if you've got any kind of issue with a student or a child, you really do need to have the parents on board, and you've got to have everybody on board, even if it's a bunch of different therapists and everyone working together. It's so important for success. You can really see the difference in the families that are all in and those that aren't.
Definitely.
Yeah. And Would you say that most speech therapists do work with kids with disability, or are you unique in the fact that you do a lot of this?
Most speech therapists would work with children who have disabilities. However, not everybody knows the same amount of information about the specific population. Because the speech therapy field is so diverse, people generally specialize in a particular area, and a lot of private therapists just can be specialized in, they can have generalist knowledge in lots of different areas. And I mean, they're all fantastic in Hong Kong. I think in the terms of the disability population in Hong Kong, I know a lot about technology for children who do have significant needs, so significant impairments, so children who are nonverbal and minimally verbal. And I've been able to get a lot of technology that I can try with different children, which is super helpful. And I don't know of any other speech therapists in Hong Kong who have the amount of knowledge in terms of the really significant need population that I do. So I do also lecture at the University of Hong Kong in alternative and argumentative communication, as well as I've given some lectures to the university, the Polytech University, as well as the Chinese University of Hong Kong to try and upskill their students. Because there actually isn't a lot of training in the local universities on working with children with disabilities. It's quite a limited knowledge area here in Hong Kong. So yeah, it's great to work with universities to train those students so they can then go out to the workforce to help.
That's so brilliant that you're doing that. How did you get into that aspect of life in Hong Kong? Were you invited, or did you get in touch and volunteer?
I worked at a big disability organisation in Sydney. It was an amazing NGO, non-for-profit, and I worked a lot with this population, children with special needs. So when I moved to Hong Kong and before I had my job lined up, I just sent my CV out to lots of people, including a lot of the people on the university's websites. I looked for names. I just sent my CV out and said, I'm here. What can I do to help you? So when I first moved to Hong Kong, I came a few months before I was due to start at the school. So the University of Hong Kong employed me to do some contract work. So to work on the training that they're teaching their students. So to write up some case studies, to do some work about how they determine the criteria for determining the knowledge of their students, of the university students in the speech therapy area, and making it more comparable to how the university in Australia teach speech therapy. Made some connections when I first started. I still do some work for the University of Hong Kong on occasion as well. And just from then on, I discussed that they needed to have a lot more work on this population because a huge number of our population do have disabilities, and there's more diagnosis now for autism. The rates seem to be increasing, and I think one of the reasons is because more diagnosis that is happening and more awareness. And if the local therapists aren't aware of how to treat this population, and then they're going to be just left, which is really sad and really worrying. Because I had the expertise in that area, they asked me to come on board, and then it kind of just went from there.
Oh, how brilliant. Yeah, I think there's a lot more awareness being raised, and there's a lot more conversations around disability and support and things like that. And it's such a good thing. This is why this podcast is so fantastic, because not only are you educating us all, because I've learned so much from what you've told me, but it's also opening up the conversation of disability. And it will get people who are listening thinking, oh, maybe a speech therapist can help with that issue, like grinding or snoring or whatever it is as well. It makes us think more broadly about treatment options as well, which is really, really brilliant. So it's great.
Right. I'm glad to have helped.
Yeah. So, Stephanie, what's one thing that people might be surprised to learn about speech therapists? Have you got anything smart up your sleeve?
I think just the breadth of the profession, just how wildly we work. Basically, when I tell anybody that I'm a speech therapist, people will say to me, oh, so you help people who can't say some sounds. You help them to improve the way that they say some sounds. And I'll say, well, it's a small part of it, but it's a little bit bigger than that. Or the other question I'll get is, oh, so how am I talking right now? So I get those questions, and 9 out of 10 times people will say to me, oh, I saw a speech therapist when I was young, or my brother saw a speech therapist when I was young. Most people have encountered a speech therapist, either seeing one individually or a family member or friend seeing one. Everyone kind of knows the speech therapists are out there, but not many people know about the depth of work that we do, and that speech therapists generally have specialties in a particular area of the field.
Yeah, it's fascinating. I had no idea myself. I really didn't. It's been really, really educational for me. Stephanie, thank you so much for talking to me today. It's been amazing. And how can people find you if they'd like to learn more about speech therapy, or if they have an issue with themselves or their children that they'd like to get addressed? How can they contact you?
As I mentioned, I'm working at the Blurton Family Development Centre. If you look at their website, you can find the information about me and my email address, and I'm happy to help. Just Google Blurton Family Development Centre and you should pop up.
Brilliant. Thank you so much, Stephanie. And I'll put that webpage in my show notes so that my listeners can easily find you. And thank you so much for coming on the show. It's been so interesting and amazing. I really, really appreciate it.
Great. Thank you for listening to me. Thank you for inviting me.
Yeah, it's been great. So for my listeners out there, if this is something that you've enjoyed, please can you share this podcast with your friends and family? And certainly if you know anybody who might benefit from having a bit more knowledge about speech therapy, that would be amazing. And if you could go to iTunes to rate and review this podcast, it'll help get me up the iTunes charts, and it will help people find Stephanie and her great work, especially with children with disability. So thank you so much for coming on to tell us all about what speech therapists really do. It's been really fascinating and educational.
My pleasure.
Hi, Confidants. I want to tell you about my Patreon page. I've joined Patreon in the hope of getting sponsorship for my Hong Kong Confidential podcast. Patreon is a great way for my listeners to get on board and sponsor me with monthly payments, and that goes towards my production costs and rewards for my members. If you're interested in checking out my Patreon page, please go to patreon.com and search up Jules Hannaford or Hong Kong Confidential. I would really appreciate you visiting my page. So that brings us to the end of another Hong Kong Confidential podcast. I'm Jules Hannaford. Thanks for joining me, and I hope you'll be with me again next week. If you enjoyed today's podcast, please can you go to iTunes to rate and review it. I would really appreciate your feedback. You can email me at jules@hongkongconfidential.net, and you can find me on Facebook and Instagram at Hong Kong Confidential. If you'd like to hit me up on Twitter, it's at Jules Hannaford. I would love to hear from you.
Love this podcast? Support it and sponsor today. Simply head to AuscastNetwork.com for details.